Good evening, folks. Thousands of nurses in our state are casting their votes right now to decide whether or not they want to go on strike again. What do they want? The nurses, they want better pay and they want more staff to help out in the hospitals, they tell us. If 2/3 of the nurses vote to walk out, a strike could start as soon as a 10-day cooling off period ends. That first nurses strike this year was for 3 days in September. But this time around, things aren't exactly like they were before. We're in the midst of a triple threat of sickness. Flu and RSV are coming on strong and sticking around, and COVID's still here. That all matters to all parties involved here and to all of us, potential patients. So let's have Kent take it from here.
Yeah, Jana, there's been some progress on pay since that first 3-day strike. The numbers aren't completely clear because we're really talking about several different negotiating teams and hospitals here. But generally, the union says they're now asking for 20% raises spread over 3 years, while hospitals are offering about 13 to 14% raises. But the nurses say the biggest obstacle is also what's contributing to those long waits in the ER right now, and that is low staffing. Just last week, hospital systems came together to talk about the strain that respiratory illnesses are having on our emergency rooms due to that crunch. Nurses say the situation is now untenable and that they are fighting for a say over staffing.
The ED is a disaster zone. They are working sometimes with only 4 to 5 nurses, and they have a waiting room of 75 kids.
We want triggers that if it gets to a certain crisis level in the ED, that staffing will automatically be increased on the floors so that we can take the patients into the beds that are not staffed and get them staffed.
Of course, the big question now is, will they opt for another strike in order to get there? The 3-day strike this fall was the largest private sector nursing strike they believe in U.S. history, but it didn't lead to a deal. And now, as they vote once again, the nurses aren't exactly sure what they're signing up for. It's just an up or down vote, and union leadership will decide the date and length of the strike after the votes are tallied. Today, those union leaders told us they know what they have in mind, but they won't be disclosing that to us or the nurses until tomorrow. Experts say it will likely be longer this time, the strike that is, which means there is even more to consider here.
They have to go unpaid when they go on strike, and that's, for someone who's in a nursing position, that is an enormous sacrifice. So I think there's probably a lot of fear on their part that they're going to be looking at a long strike. They also know that that has enormous implications for patients. So I don't think that nurses take this lightly. I think they take it very seriously, but I think they are frustrated and angry.
Now, Allina Health is among the several hospitals negotiating with those nurses, and in a statement ahead of the vote, they said, "We believe that a settlement is attainable and urge MNA to focus its energy on bringing these negotiations to conclusion rather than asking its members to consider another strike that our community can simply not afford." Now, today, a national expert on labor education told me those two things aren't mutually exclusive. And he says, once again, many across the country are watching Minnesota to see if this strike vote is enough to finally strike a deal before another walkout.
The stakes are high on both sides, so I'm hopeful that even the threat of a strike, even a strike authorization vote, may be enough to apply pressure for management and the hospitals to perhaps do the right thing by way of the union and be able to settle this before a strike actually happens.
Now, we will know the results of this vote around 10 o'clock. We're told a little after tonight. And if needed, union leaders say they will announce the timing tomorrow morning. But regardless, more negotiations will take place between these two sides on Friday with the hope of resolving this again before any kind of walkout.
Yeah, and everybody talked about how much different this feels, and you really explained it well. It feels stressful just as a resident of the state of Minnesota to have this strike looming.
Yeah, it really does. It really does. And it's one of those things, too, that this is on those nurses' minds. And again, they've also been dealing with some of this sickness and this short staffing. And as they go into this decision, again, this time they don't necessarily know if it'll be 3 days or if it's going to be an open timeline.
Yeah, and I was just reading, too, shortnesses of medications continue. Thanks so much, Kent.